Hi, I'm John King. I'm on the Commission for Alcohol and Drug Policy, and I have been since 2009. We are attempting to organize and benefit the people of Oregon around drug and alcohol policy. It is a commission that is got some really great people on it, including Attorney General Kroger, Bruce Goldberg, Oregon Health Sciences, Oregon Health Authority. We have a large complement of law enforcement, social work, prevention and treatment people as well. Today we are on the Capitol steps to give thanks to the state of Oregon legislators for recognizing that alcohol drug treatment and policy is important, and that treatment and prevention actually are effective. And we are the evidence of the fact that alcohol prevention and treatment is an effective method of helping our citizens to have healthy and productive lives. In years gone by, I have been drug addicted, but through the assistance of the state of Oregon's treatment, I have become a useful and productive member of society, and even to occupy an office in state government. It is not to my credit, but to the credit of all the people who came before me. It's like it's been said, I see further now because I stand on the shoulders of giants. What we are attempting to do is to give a hand to people who will also be able to stand on those shoulders along with us, so that in the future, less people will be a victim of drug addiction and more people will be contributing members of society here in the state of Oregon. It is my honor to be able to be of assistance to my fellow Oregonians, and it is my pleasure to introduce to you Gary Cobb, who is with Central City Concerns and is also here in that effort.
Thanks, John. Hi, like John said, my name is Gary Cobb. I'm the Community Outreach Coordinator at Central City Concern. And I think for me, having I've been able to be in long-term recovery is a direct result of accessing the Oregon Health Plan in November of 2000. Today I have other friends and colleagues that I work with, other men and women that are experiencing the pathway to recovery that John spoke about, and what I just shared with you. And I think that in spite of the budget situation that our state is in, I find it very awesome, in no other words to put it, that the state legislative body has been able to hold to no cuts to addictions treatment services in the state. And I think it will only help our state's economy as folks get clean and become self-sufficient and become the tax-paying citizens that these programs are designed to help folks become. And I think that's about all I want to say right now. I'd like to thank Dr. Bruce Goldberg for walking out and letting us catch him on the steps there real quick. If you just could say hi, and then, not to put you on the spot. Sorry.
Oh, sure, absolutely. One of the most important things we can do to help people be healthy and help our communities be healthy is to do all that we can to treat alcohol and drug addiction. And it's fantastic that people are here today to show not only that we should, but that we can, and that it really works. And that's a huge statement. And someone once said that statistics are just people with the tears wiped away. And indeed, we've got real people here today to tell the story far better than numbers. This is something we can do, and we should do, and we will do.
I'm the Executive Director of the Miracles Club, a peer servicing agent in Northeast Portland that serves for the majority of part African Americans to re-engagement in the society coming off drugs, alcohol, or in prison.
So I represent Oregon Prevention, Education, and Recovery Association, which was OPRA. I also represent ORPA, which does some mental health issues as well. It's good to see. I see you on the Drug Policy Commission every day. And so in that role, and I've been doing this for about 4 or 5 years for them. represent from the provider side on the addictions, but really that it doesn't matter whether you're a provider or someone who's actually part of the community who works there or whatever. It's all the same to us. It's kind of all the same issues. So I work on policy issues. I try to help on budget issues, so try to prevent cuts to the addiction community, and then also we try to organize our groups to come down and meet with key stakeholders. A lot of the work that happens is outside of this building, so a lot of the work happens on the Alcohol and Drug Policy Commission, which is a really important one. We help get that passed so we can actually have an Alcohol and Drug Policy Commission in the last couple of biennium, and then also with agencies, so state agency work and that kind of stuff. So that's kind of my role. I work really closely with Gary. Gary is up there doing his job every single time we have a key committee hearing or doing it in the budget. So Gary knows a wealth of this information. I learn a lot from Gary because I haven't been doing this for as long as Gary has been doing it in the addiction community. So anyway, thank you guys for being here, and glad you guys are here.
We're probably one of the most cost-effective recovery centers that there is. However, we could be a much larger effect with the continuation of support. So I want to thank you guys for allowing me to be on film here today, just to say thanks to the legislators. We thank you so much.
Four. Okay. Yeah.
Hello.
I'm John King. This is
Herman Bryant, Miracle Club.
Hi, nice to meet you.
And we're a small delegation of people in recovery who wanted to thank Senator Berger and some of the legislators for their support of treatment and recovery, and a lot of other people
Oh,
that presented
okay.
as well.